Since 2007, Buying Time has supported entrepreneurs and therapists on their admin, marketing, and bookkeeping needs, and so much more. Check out their free Buying Time Systems Inventory Checklist to uncover hidden expenses and optimize spending in your practice. Find that at buyingtimellc.com/MTSG.
Therapists, with summer around the corner and kids on vacation, clients may have more time to level up on therapy. If you want to make therapy more accessible for them without compromising on your full private pay rate, you'll want to check out Thrizer. They make the out-of-network process so much easier. No more super bills, no more insurance calls, and best of all, no more months-long reimbursement waits. Go to join.thrizer.com/modern therapist to learn more.
You're listening to the Modern Therapist Survival Guide, where therapists live, breathe, and practice as human beings. To support you as a whole person and a therapist, here are your hosts, Curt Widhelm and Katie Vernoy.
Welcome back, Modern Therapists. This is the Modern Therapist Survival Guide. I'm Curt Widhelm with Katie Vernoy, and this is the podcast for therapists about the things that go on in our world, the things that go on with our professions, the ways that we can serve some of our clients better. And we are always happy to have guests on who are able to talk about populations and clientele that Katie and I don't normally work with or aren't major parts of our practices. And so we are joined today by Michael Pezzullo. He's an MFT and helping us to learn more about working with gay men in practices. So thank you very much. And I'm looking forward to talking about this more. I know that our practices are not far apart. You're over in West Hollywood. I'm in the Valley in West LA. We've got some overlap in our clientele. So always love to learn more from people who know more than me. So thank you for joining us.
Thank you for having me.
Yeah, I'm excited about this conversation too. But before we get into it, I want to ask you the question we ask all our guests, which is, who are you and what are you putting out into the world?
Yeah, so I'm Michael Pezzullo. I have a private practice in West Hollywood, but I also see people remotely throughout California and also Florida now as well. And I do some coaching internationally also. But what I put out into the world is I do a lot of work with gay men and gay men's issues, and sexual trauma has become one of the most prevalent things I've seen in my practice, which is why it's become something I talk about pretty frequently.
So we start a lot of our episodes with a question that comes not from a shaming place, but if people are already making mistakes, let's help them not make mistakes. If gay men come into their practice, what do most therapists get wrong when working with gay men?
That's a great question. And I think it's all about, right, like helping each other, not about, our mistakes are not to be shamed, but they're to be worked on. And we're all a work in progress and we're constantly learning. And that's just the name of the game, right? We're working with human behavior and the human mind. It's going to be endlessly evolving. So I would say a couple things. I think there are just some basic experiences that gay men go through that someone may not be aware of. I think you can be an extremely informed ally and be an incredibly effective clinician, but there are some basic things I think that do need to be addressed. For example, the hookup culture right now in the gay community is very app-focused, but in a little bit of a different way than it is in, I don't want to say like the straight community, but, non-gay male. So you just want to be aware of some of the common things that go on so that when you hear them, you don't think it's abnormal. I think that's the mistake that I hear more often, is that a gay man will discuss sexual practice or sexual behavior that's extremely normal, and the therapist will clock it as being off when it's actually not.
I think you need to expand more on this.
Sure. Yes, no problem. For example, so if you have a client, for example, who is in a city alone and they go to a bathhouse, for example, that could easily be taken as like oh wow, that's a more unusual kind of extreme thing to do. Where in the community of gay men, it's not. Or for example, like going on a hookup app and meeting up with someone and having, unprotected sex because you assume that they're taking PrEP already, or that if they are HIV positive, they're undetectable. Stuff like that. I've seen, straight clinicians clock that as being something concerning or just out of the ordinary when it actually isn't. It's a common behavior.
It's interesting because I know for myself, I've had some gay men clients who've talked about some of these things, and I've not clocked them as abnormal, but I think it is hard to know what is truly risky, what is normal, but also has some risk involved, and what is just totally normal and not a risk at all. Because to me, I'm an old married lady. And so I have a very different lifestyle than even the hookup culture. And so when we're talking about those things, and then also potentially sexual trauma due to some of the risks that can be taken with some of these hookup apps, I think it can be hard to sort through it. So can you talk us through how to sort through what's risky, what's normal and risky? How should we clock it, I guess, is really the question I'm trying to get to.
Yeah, absolutely. So what I would say is that, being a gay man on a hookup app, if you're not on a hookup app, you're probably not breathing. Like that's just where you're going to be. But within that realm, there are different apps. So there's like Grinder and there's Scruff, and then there's also like BBRT and Sniffies. There's a range in the terrain that's good to know about, where some apps are used much more for lots of talking and exchanging pictures and verifying, and some are much more immediate hookup. I don't really care who this is, what my safety is, and so on and so forth. And some apps lean in different directions. So depending on what you're looking for, you may be on one or the other. So I think being on hookup apps in general is part of the world. Same thing with going to clubs or bathhouses where there's sex going on. Doesn't necessarily mean someone's participating, but if they're going, I would say that's extremely normal and sort of par for the course for culture. But to your point, though, of assessing risk, I think when that gets into the realm of drug use, if people are doing meth, if people are doing hard drugs, and that's probably the drug you're going to see the most, actually. A lot of gay men use poppers and GHB when they're having sex, which, sort of debatable about how healthy that can be, but it can be used more in moderation. But there are lines that start to get drawn, I think, particularly when you get into the harder drugs that you see a lot on these apps as well.
So there's the risk with drug use and where that can kind of get out of control. There's also risk of sexual assault.
Yes. Yes, absolutely. And I think what I've seen too is that those two things go together pretty strongly as well. That when you are going into an environment where there is rampant drug use, particularly drugs like meth that increase, libido astronomically and lead to people behaving in sexual ways that they wouldn't normally, that the ability to give consent gets lost, and the people that you're surrounding yourself with potentially may not be interested in obtaining consent in the first place. So, and these are two very different experiences. I think if you talk to most gay men, I guess we're of a certain age of late 20s, early 30s, at a certain point, start to become aware of knowing which kind of hookup is going to be risky and which one is not.
How is that assessment done? Which hookup's going to be risky and which one's not?
Yeah, it's done on the apps. So it's done by getting clear photos. Some people that want to do drugs and party will say it. They'll put it out there. There's like symbols. They'll put like diamond emojis in their name or in the conversation to indicate like a crystal, or like a smoke to indicate that they want to do drugs with you. So some people will tell you, but there is almost like a vernacular and a code that you become familiar with pretty quickly to assess. Same thing like with, I think, any kind of digital safety these days, right? When you're on the internet, you can kind of sense kind of quickly if you're on Instagram even, like, is this account a real person or is this a bot? You can get a sense of like, how safe is this person I'm interacting with? Those sorts of things come into the conversations on these hookup apps as well.
In the larger gay community, with some of this risk for non-consensual sex or sex that becomes more aggressive than is primarily agreed to, how is that addressed in the larger social context? I think that it's one thing when we're looking at this in kind of a one-on-one situation, but I'm sure that within social groups, even within the community, how is this looked at and either supported or just kind of pushed away?
It's a good question. I think that there are certain spaces that gay men occupy that are less boundaried, where when you walk in, you're almost giving like this implicit permission that I am sort of consenting to something, or I'm sort of not saying, it's a little bit vague. And so what I talk a lot about with people that I work with, especially if they've been through sexual trauma before, is going into those places. I do think that you're giving this sort of subtle invitation that something is probably all right with me and I haven't defined it yet. And it's almost like I'm saying yes until I say no, rather than the other way around. So I think it's really important to have those conversations with people and let them know what they're walking into. Because I've seen people just get surprised. They go into, they go into a bathhouse, they go into a festival, it's very sex heavy. They go into a sex party, something like that, and they're taken aback by how little their boundaries are respected or even acknowledged at all.
When you hire Buying Time, you get an entire team of accountable, knowledgeable virtual assistants with different specialties. It's a pretty amazing one-stop shop for your business needs. And I should know, I've been a happy customer of Buying Time since 2015. Buying Time has helped me and other therapists with admin and client customer service, finances and bookkeeping, including sending out invoices and super bills, setting up automated systems to take care of clients during onboarding, marketing, including website, social media, blogs, and newsletters, and a whole lot more.
Buying Time believes in streamlining, efficiency, and being cost-effective. So they help you to regularly evaluate systems to make sure you're not paying for programs and platforms you don't need. And they've put together a free systems inventory checklist to help all of us to uncover hidden expenses and optimize spending in your practice. Go to buyingtimellc.com/MTSG to get your free checklist now. I imagine for a lot of clinicians, and especially within larger discussions around privilege and that kind of stuff, that some of the concerns brought in by gay men might be minimized just by the fact that they're men and by being victimized on this. And I'm wondering what kinds of themes, as you're nodding aggressively to me mid-question here, I'm wondering what kinds of themes that you end up hearing from some of your clients that can speak especially to this and the kind of work that you do.
Absolutely. This is something that catches my attention a lot. I think that, in our culture, we're not very sympathetic to men in general in a lot of these ways. We're viewed as the problem, not as having problems or suffering from problems in a lot of spaces. And I think that shows up for gay men as well, that it goes contrary to a lot of these ideas about gay men we've been socialized to believe that they can be victimized, especially if you're willingly going to a hypersexual party or event or whatever it is, or you're getting on an app, that it doesn't look like a clean victim, for lack of a better term. And I think that's a problem we have in our culture in general, is not viewing men with a certain amount of sympathy and compassion that we deserve. I think it's getting better, but I think that's something that's like pretty universal that I've seen.
So when your client feels victimized, they feel that their boundaries not only weren't respected, as they were entering into something, but that if they actually set a strong boundary, said no, removed consent, and it was not respected. When we get to that spot where they have been sexually assaulted and are facing this bias that, well, of course, they couldn't be a victim, and potentially even you should have known this is the culture, or, you were supposed to set up these permissions and consents ahead of time. It feels like it would be very hard for a gay man to come in and say, I've been victimized, and to speak to someone who has this assumption that they knew the risk, they took the risk, they, somehow either misinterpreted, or it's kind of that blaming the victim thing that I think happens a lot of the time. And so when a gay man comes into your practice and that's what they're talking about, they're saying, I was sexually assaulted and it destroyed me. How would that work look different than working with anyone else who's had sexual assault?
So I would say that more often than not, they won't come in and say it that way.
Okay.
The information will come out very slow, and they'll usually be very hesitant to label themselves as a victim in any way because of how ashamed they feel about the experience. So I think what happens more often than not actually is that as a therapist, you start to clock it that something, wrong happened. There was some sort of violation. And you have to tread very lightly to let them know that that happened and to see how they can digest that. What I experience more often than not is I hear something that sounds like abuse to me, and they're phrasing it as though it was okay. And starting to tread into that world of, is it possible that this was violating in a way that's hard to name? And often that there's a lot of resistance to that too, of not wanting to feel like a victim or not wanting to feel like, you know, I couldn't have done something differently or something along those lines. That's what I see more often than not.
Are there other signs that end up giving indications around this, such as the way that people talk about some of their non-sexual relationships and some of the ways that people who've been victims or people who've been the targets of some of this kind of assaults end up attaching to other people, either within their community or on the other end of things, just completely kind of isolating?
I think, one thing that's so important to do with, I think, any client, specifically gay men, when you're working with them is getting a thorough sexual history, just like you get a family history, but really going through the details. Because, I know generations, it's changed quite a lot, like Gen Z gay man versus millennial gay man. Like, I'm a millennial, is so different versus Gen X. Like, our community is interesting in the sense of things have changed so rapidly. So the experiences are quite different already. But if you just take my age group, for example, you get a sexual history, the development is a little different of when was your first sexual experience with the other man. Oftentimes it's with someone who was older, who was an adult and they were a teenager. And it was often maybe in a place that was secretive, like in a, hidden corner of a bookstore or something or other, rather than like I'm just a young guy and I see someone I like and I go towards it. It has to happen in the shadows. So there's often this way that it evolves that's a little bit different. So I think it's so important to get the details from a person to understand, how did their sexuality develop? How confident are they? Have they experienced boundary violations before? I think with gay men, even if it wasn't like a direct assault, there's going to be instances where they probably felt targeted, or they probably felt like people were trying to out them or shame them, or, older men were suggestive with them when they were still in the closet and they were teenagers. Things like that, I think, are so important to assess and to understand.
It seems like a very important what to do. I'm imagining that there's a very important how to do that in an affirmative way too. That's not just kind of, all right, let's go through a list of everything that's ever happened to you. Do you have recommendations on that?
Yeah, so I think getting consent, of course, like, I want to ask you about your sexual history. Is that okay? And then as you're asking questions, tracking like, how are you feeling right now? What is it like for you when I ask you about your first sexual experience? What is it like for you when you describe, just really tracking their comfort the whole way along?
Really wonderful trauma-informed kind of work.
Yes, yes. But I think being bold too, like not being scared to ask the questions too, even if you're not a gay male therapist, that you're showing curiosity about this part of them.
Where do you fit it into your assessment? I guess maybe the broader question is, what would your initial assessment look like with a gay man?
It definitely depends on the person. I think like for all of us, right? And some people, you can get a sense pretty early on if this person is more comfortable being forthcoming with details and this person is not. So that may tend, and obviously if someone's coming in and they're a gay man, but their issue has nothing to do with sexuality, obviously I'm not going to say, hold on, don't talk about your depression. Let's talk about your sexual history, because it just seems like off topic. But I do think, early-ish, it's an important moment to have with them. And I think it's, we always talk about being affirmative, but I think really being affirmative is going into the terrain with them rather than just saying like, I'm an ally, like being curious.
So what type of questions? Where do you start with an assessment with a gay man?
So if I'm doing like a sexual history, asking like, what was your first memories that felt sexual to you? What were your first crushes? And also asking about porn, right? Like, when did you first discover porn? I heard this, porn has become such a horrible issue for men in general in this country. It's become such a problem. But I read a statistic recently that the average person is exposed to porn for the first time when they're 8 years old. I mean, so it's really, really young. So getting a sense of that, of when were you first exposed to explicit content, and, how much space that take up in your life. And then getting a sense of when did you do something sexual for the first time with the woman or with the man, or, if they were in the closet for a while, figuring those things out. And then getting curious about, what do you like? What are your interests? What, just very open ended. Same thing going to a restaurant, of what on the menu is appealing to you, what interests you sexually, and just really normalizing that's part of being a human being.
Some of the gay male clients that have come into my practice, as you're describing, come for seemingly completely different reasons. And I'm glad to feel validated in the way that you're describing things, that there's kind of the trickle to, oh yeah, and by the way, this is something that happened. One of the themes that I had noticed is really, when it does come to sexual trauma, especially within the community, it's having the interpersonal relationships with some of the people who may be perpetrating some of these boundary violations, and being able to navigate some of the social scene with that. It's a tight-knit community in some ways. It's very loose in other ways, as I've come to understand things, but recognizing that this is not just about those traumatic moments, but navigating some of the social aspects of it. What kind of recommendations do you have?
Yeah, and I think this is where, also as a therapist too, I think that countertransference is huge when you're working on these kinds of issues with trauma, sexual trauma, and clocking your own reaction. I've also found too that a lot of gay men often idealize their therapist if it's another gay man. There's almost this assumption that whatever they're struggling with, I know how to do it. Like, if they're struggling with boundaries, I have great boundaries. If they're struggling with confidence, I have great confidence. Like that, it just seems like it comes into the room, and I don't dispel it and tell them, of like, no, I have all kinds of self-esteem issues or anything like that. But I just notice it too, that if I'm proclaiming something as a way to do something, that may be taken as gospel, and I want to just be weary of that. However, with all that being said, I guess it's sort of a dialectic. I am a strong proponent of not just setting boundaries, but guarding your boundaries. Because I think boundaries are useless if you don't actually enforce them. And I do think that's something that you can really coach people on in a more behavioral way, of how are you going to make it clear that you don't want to do this.
Therapists, are you providing super bills to your clients? The bad news is 5 in 10 clients don't submit them, which means they are leaving thousands of dollars on the table. The good news is there is a solution. Thrizer. Thrizer helps clients automatically tap into their out-of-network benefits without the hassles of super bills, insurance calls, and even months-long reimbursement waits. With Thrizer, clients get instantly reimbursed for out-of-network sessions, all while you get your full private pay rate up front too. Here's how. First, clients verify their out-of-network coverage with Thrizer's free benefits calculator. Then, Thrizer takes care of submitting claims and dealing with all the insurance stress.
But what truly sets them apart is Thrizer Pay, the option for clients to just pay a copay for sessions instead of waiting 6+ weeks for a reimbursement check. They even cover the rest of the therapist's rate to make you whole up front, and then wait for reimbursement on the client's behalf. This isn't too good to be true. Thousands of clients and clinicians are already using Thrizer to make the therapy process more seamless and accessible. Check them out at join.thrizer.com/modern therapist, or use the code modern therapist for a free special offer.
Or some people who come from family of origins where those boundaries have been ignored for years, and especially if it's coming from not a supportive family of origin where they don't have some of that practice. How do you scaffold that for some people who might be learning this out for the first time in their 20s, 30s, or even later?
It's a tough question, and it does play obviously into personal biases about how you see the world. So I try to be aware of that, but my personal philosophy is that it is my job to set my boundaries and to guard them. It's other people's job to respect that, but if I don't say it, if I don't make it clear, then I don't hold people accountable. Obviously if there's something like overtly wrong, There's certain things we all agree on, but that's kind of how I stand with things. So that's usually the perspective I take with clients. And again, I found that most people who weren't raised to, who were encouraged to have no boundaries, that they can do the task of saying the boundary every once in a while, but when it comes to enforcing it is where things tend to fall flat. And that's where I think the work really has to be about helping them understand what happens when you cave, like what happens when you let go.
It seems like just with all that you've already described, that interpersonal relationships generally, not just sexual, but all interpersonal relationships, could be impacted based on how boundaries are seen within the community or the types of relationships that you most frequently have. And I'm curious, what themes can show up in their adult relationships, the interpersonal violence, attachment. Like, what are the things that you see frequently come into session that maybe aren't specifically sexually related, but have a role in how they interact with the world interpersonally?
That's a good question. Yeah. I think obviously this is probably a little bit biased by the area that I'm in, but I think one thing I think that's very pervasive for gay men, especially gay men who are a little bit successful and educated and, doing well enough to live in this town, which is not, not cheap, right? That there is a lot of presenting. There's a lot of, kind of like velvet rage stuff of looking the part, presenting well. Like there is such an over index on that I think is still so pervasive. And I think one big problem about that is that when you're working with a gay male client who is, educated and smart and attractive, that it's easy to minimize the distress that they're in because they don't look distressed. And I think a lot of gay men have been socialized to do that, to be as appealing as possible, to compensate for some sort of internal sense of shame. And I think the problem with it is that it works. We get rewarded for doing that. But I think oftentimes what ends up happening is that people miss their distress. Even being a gay man, I've caught myself doing it too. So I think that's the interpersonal dynamic I see the most frequently.
It seems like that would be hard to break through if it's so ingrained, it's so rewarded to be okay.
Mm-hmm.
How do you address it?
I will tell you, I think it is really, really tough. The resistance to going there, especially again, too, like, if you get some gay man who is stereotypically attractive and probably has been his whole life, and there's a part of him that is very celebrated in the world, and that's very appealing. But there's another part of him that has gone starved for decades, and trying to allow them to place some attention on that part of them, I think takes a lot of time and a lot of trust and a long-term therapeutic relationship to be willing to go there.
In some of these long-term relationships, we can't fast forward some of the relationships that we have with clients, but what are some of the things that you have found to be effective? I'm imagining that there's a healthy amount of self-disclosure that allows for some gay men to open up to you, but for therapists who are not from the community, what are some of the things beyond just saying, hey, I'm an ally, that really does end up inviting in some of the safe space markers that shows that, hey, we're here to do the work with you?
I think that's a fantastic question. What I will tell you, I have had so many therapists over my life, as I think most of us have. But I remember, when I went to therapy, being gay was never like a topic I brought in because it really wasn't. I had other stuff I was working on, But I remember so specifically, I had this woman who, when she asked me about a couple things about it, and I just kind of quickly glossed over it because I didn't really have much to say. I didn't have a lot of like quote unquote gay trauma necessarily. And she stopped me and backpedaled and just was very intentional about taking the time to ask me, well, like the questions, kind of like a sexual history questions of, well, when did you come out and when did this and da, da, da. So it wasn't just saying like, I love gay people, thumbs up, but it was truly like inquiring about, and she knew some of the stuff. She knew some things that she didn't have to know everything, but she knew a couple of key details that really clued me in of like, oh, she gets this. And it did something to me that it gave me a sense of safety with her that I didn't know that I needed until I had it.
You kind of briefly talked about this at the beginning, and we're running short on time, so I don't think we'll have time to go into it now. But I want to know stuff. And so if I want to know stuff, I want to have a better understanding. What are some resources that you would recommend for therapists who aren't gay men to have more knowledge that would be supportive of in having informed conversations with their clients?
Absolutely. Yeah. Social media, TikTok, YouTube, go to the people. If you go on YouTube and look up influencers who are talking about the average gay man who's talking about his life and stuff he's struggling with, that's how you're going to get the real perspective of, oh, this is what people really have to say, rather than the Advocate and HRC. And sometimes I read stuff and I'm like, I don't know who they're even talking to. Like, it's so academic and so speaking about such fringe issues. I'm like, this doesn't really speak to the average gay guy that I know. So anyway, long story short, I would say go to social media and just watch reels of influencers or even just, average people talking about like dating as a gay man.
One of the themes that we've hit on in some of our interviews this year, and it seems to be a question that we need to make as part of our regular rotation, is there's a lot of therapy models and a lot of life models where it's made for the masses, or it's made for the privileged, or it's made for kind of the systemic things that existed 30, 40, 50 years ago. And then there's what actually exists in the community, to what you're just talking about as far as following reels and that kind of stuff. When it comes to some of the sexual relationships, the healthy relationships, what do you recommend therapists do when talking to gay men about this kind of stuff?
Yeah, so I think it's a really careful balance of, we do not want to be the arbiters of what healthy sex has to look like. Because it's interesting, if you Google that term, you're going to get all kinds of weird answers, and they're all pretty vague anyway. It's affirming, it's celebratory, it's wonderful, and it's a lot of adjectives, but no details. LGBT people, gay people already grew up being told that the type of sex they want is abnormal. So I think suggesting to someone there's a paradigm they have to follow that's correct is going to be shaming by, just by happenstance. However, I think this is a careful balance to strike. However, we do want to help people identify boundaries and have sexual practices that are safe and are not violating. It is a delicate balance, but I think it's one that's important to walk. For example, open relationships or non-monogamous relationships are very common in the gay community. And these days, if you bring that into therapy, I think more likely you're probably going to get the, oh yeah, that's normal, just go do that. Like that's the way to do it. And I think that's wrong. I think it should be about helping the person come up with what's right for them, what's healthy for them, rather than suggesting something, even if what you're suggesting seems liberating, if that makes sense.
That makes a lot of sense. It's asking the questions versus co-signing.
Yes.
How does that feel for you? What would that look like for you? What relationships are you currently in? What are the agreements that you have? It's kind of looking at, how do we show up and see the client in front of us and not be hindered by old practices, but also not be just ready to co-sign on anything, because there's so much diversity and so much creativity that happens in our world
Mm-hmm.
in these areas. So I like that a lot. I think that helps to clarify that.
Oh, good.
Where can people find out more about you and your practice?
Yeah, so my website's my name, michaelpezzullo.com. I have a very unusual last name, so I promise it's definitely me. And yeah, they can reach out to me. I do, free consultations and so on and so forth, in person here in West Hollywood, and then I'm virtual in Florida and California.
And we will include a link to Michael's website over on our show notes at mtsgpodcast.com. Follow us on our social media, join our Facebook group, the Modern Therapist Group, to continue on with this conversation. And until next time, I'm Curt Widhelm with Katie Vernoy and Michael Pezzullo. Buying Time is a full-service virtual support agency that is standing by to support you in your practice. It's time for you to get out of the day-to-day and bring in someone you can trust who has the experience to help you with all of your business needs. And don't forget to go to buyingtimellc.com/MTSG for your free systems inventory checklist to get on the path to less expenses and more profit.
Remember to automate superbilling with Thrizer. Clients just pay a copay for your sessions while you earn your full private pay rate. Transform the entire process for your out-of-network clients. No more superbills, no more reimbursement calls, and the best part, no more reimbursement waits. Grab our exclusive Thrizer free trial at join.thrizer.com/modern therapist or sign up with the code Modern Therapists.
Thank you for listening to the Modern Therapist Survival Guide. Learn more about who we are and what we do at mtsgpodcast.com. You can also join us on Facebook and Twitter. And please don't forget to subscribe so you don't miss any of our episodes.